I'm Dr. Mario Garita from San Jose, Costa Rica, speaking to you from my home, following all the recommendations by the sanitary department and the government to stay home, stay safe, and waiting out this pandemic, corona crisis issue that's affecting us all. Nobody gets away with this. We just have to wait on it and hope that everything turns out okay for most of us, and just follow instructions. It came to us the idea, since we are here at home, we can't work because all offices are closed down, to talk a little bit with our patients and future patients who keep on writing to us asking for treatments and what should I do with this and what should I do with that. Tell me, doc, what's the issue with implants, and also all different types of questions related to what we do every single day. We decided to take the opportunity and get together with you guys here on Facebook Live. So we'll try to answer most of the questions that we have here in list, and all of them that will come out live during this time that we're going to be sharing together here. Once again, thank you for joining with us, and hope that we can enjoy some time together here and answer some of your most important questions. Let's talk a little bit first before we wait for some other people to join, regarding this coronavirus issue. Uh, I listened to the daily from the New York Times. That's a very interesting daily news, about 30 minutes. It's made by Michael Barbaro, and they talk about specific topics that are trending now. And of course, they're talking about coronavirus. Yesterday, I think it was, they had the topic about the vaccine, which was very interesting. He was interviewing the scientist from a lab in Germany, and he was dedicating a lot of detail on it. But just to make it quick and just to give you some information about it, what made me feel a little bit better, he says that the funding was ready by the end of January. Research started immediately. Now they're in the period of trial part on mice. They are getting the vaccine ready. It should be ready for human trials by June, July. And after that, it's just a question of about 5 or 6 months before the vaccine is ready and out for production and massive delivery. So it's not as far away, but during that time, we need to stay safe. We're not going to be in quarantine for so long. We're going to be back to work as soon as government officials tell us that it's quite safe to work with, and so that we can start producing a little bit, start seeing patients, start bringing our personnel back to the office, so that everybody has work to do, and everybody gets paid, and they can keep on living their lives and maintaining their families. All right, let's talk about a little about dental implants now. We're in the age of dental implants. That's when everything changed in dentistry. Before that, when my father was around and he was practicing his dentistry, everything was related to bridges over teeth, dentures, partial dentures, etc., but nothing that could give the patient the comfort that dental implants give. So when dental implants appeared, was more than 30 years ago. They have been evolving over time, and everything changes. Technology, materials change, and that's the part when it comes. And I usually say not all implants are created equal. There are some implants, which is most of them, they are a copy of an old version of a big implant house. And those are what we call mimics. Those are what we call Mickey Mouse brands. And those I don't use, and I don't recommend people to use them because they were once used, they were proved wrong, and then they evolved. But the patent is open. That's why they are fabricated and they're sold very, very non-expensive. When we use implants, we use only top implant brands that can guarantee you that it's the best material and design available. Dental implants, it's designed to be a predictable long-term solution for all of our patients. Which option of treatment is right for you can only be determined once you are evaluated and once we determine your needs. When a patient comes through a door looking for treatment, they come looking for teeth. Most of the time, that's when they learn about the option of dental implants. They heard a little bit, but they didn't know much. They didn't know how they were used. They didn't know how will they be cared for. What's the procedure on this? On the initial evaluation of the patients that we see, it's very important that the patient understands that we need to know as much of them as possible. Of course, besides their health history and medications and all those variables that need to be accounted for, and we need to be informed so that we take our precautions for your health. We need to know about your age. And talking about your age, meaning we need to focus on how old the patient is, but also how old is the smile and your teeth that you have in your mouth, which sometimes are not similar. Some patients have 30 years old, they can have dentition of a 70-year-old patient. So they should be viewed with treatment options similar to the we see patients with 70 years. We see patients that have very similar age patterns in how old they are and how old their dentition is. And that gives us a great value or a great reference in terms of deciding which is the best treatment option. It's not easy because most patients can't imagine what is really going on with their mouth. They just feel and they don't accommodate good to eating or to smiling or to the everyday life. And it's important for us to talk about how you feel, how the patient feels with themselves. I'm going to rephrase that a little bit. My wife was telling me the other day that she was receiving a little lecture about this lady that talks very nicely, saying that the person you talk the most, who is the patient who you talk the most during the day? And I told her, well, should be me. And she said, no, I talk the most to myself. Yeah, and that's true. As soon as I open up my eyes, my brain starts talking to me and it starts saying, what a beautiful day or a horrible day. It's raining, there's a lot of sun. What's that noise over there? All those little things start building up in your brain and start to prepare you for a good, mediocre, or bad day. Let's take the role again in terms of teeth. If a patient is suffering from bad teeth, bad odor in its mouth, moving teeth, pain being the worst, bad flavors, as soon as they wake up, they realize their problem once again. So they get up from the bed with their left foot, meaning they will be complaining in their head as soon as they get up from bed. They are not happy cleaning the teeth because they say it's not worth it. They are not happy smiling to the mirror, giving you a good feedback, a good emotional support to start the day properly. And of course, when they reach downstairs and they want to have some breakfast, if they might not even be able to bite into a toast of bread. Those are the cases that we help in the office. People who are desperate of coming into us looking for a solution for their basic dental needs. They say, you know, doc, I'm tired of this. I need this solved. And here in the US, I went to a local dentist and they quoted me X amount of dollars and I cannot afford that. Is there something that we can do? Okay, and that's where we kick in. Yes, there is. There are many things we can do. And why in Costa Rica it's much less expensive than in the US? I'll talk to you about that in just a bit. But in comparison, you're saving at least 60% for coming down to Costa Rica to get your smile redone, your function reestablished, to bring your life back to where it once was, where you are comfortable with yourself, when you are comfortable smiling at other people. All right, the reason you are able to save more by coming here to Costa Rica, it's not that we use cheapo or materials imported from who knows where, etc. No. It's not that. We use exactly the same implants and materials that my friends dentists in the US use. The big difference it's in the overhead of the business. Rentals here in Costa Rica is different. What we pay the mortgage for, it's way less. The prices of the land, of construction, it's different. Wages, salaries, everything is different. Insurances, everything it's way below. Besides that, it it's just a question of not wanting to exterminate the patient from once. We wanted to help as much people as possible, and we want to make it affordable for most of our people. In fact, we even work with a company in the United States who's a third-party financing agency, and it has helped many of our patients. Let's see, I think I have a question here. It's from Mr. Daniel. He says, thank you for your question and answer session. I was wondering, how long have you been working with dental implants and what is their success rate? Excellent question, Daniel. I've been working in the field of implant dentistry everything since I graduated, which was 27 years ago. And ever since I've been back here in Costa Rica, we've been building a big office, including other specialty members that work with us, prosthodontists, root canal specialists, orthodontists, periodontists, everything, and me as a surgeon. And we've been able to help more than 6,000 US and Canadian patients from that day on. I think it's more now. Dental implants have a success rate in my office, in my hands, of 98% success. And that's the reason for that being is that we only use top implant brands. I want to be sincere. I've used some other brands because I needed to try them out. I need to see by my own hands, why is there such a difference? And there's a huge difference in terms of my experience on it. With my own hands, I placed different systems, and the results are, they vary maybe from 85% to 98% success rate. Why? Because implants don't maintain in the mouth in the same way. The design has a lot to do with it. And one of my biggest recommendations here is that you always ask for the best implant material, best implant brand available. Because they all say all implants, well, those are lifetime guaranteed. Yes, and it's true. Because to the implant company, there's really not much expense to support the dentist who's using their system. And if the dentist says, listen, this implant failed due to this and that, the implant company will give it back to us, and we can place the implant to the same patient at very little cost. But the problem is what the patient needs to go through in order to get that implant replaced. Meaning, let's think about it if it was you directly. You come in and I put in 3 implants. When you come back, one of them failed because of X, J, and Z, whatever. Means I need to take it out. I need to clean out the area. I need to put in a new implant. I need to do another bone graft, and I need to close it up again. Another waiting healing time of 4 or 5 months. Then you need to come back, and then I need to fabricate my final crowns. If the implants are not the good ones, you might get some what we call peri-implantitis, which is an infection that's localized around the neck of the implants. Those infections are annoying. Those infections will destroy your dental work and will destroy the implants that you already invested in. And you can avoid that by using top implant brands. We see it almost every day in our practice. People who walk in said, Doc, listen, I had this and this and this done, but this is happening. I have soreness in the gum here and there. You check it up. There's a little peri-implantitis infection. We start to treat it. Our periodontist is very good at that. We try to solve the problem, but the bone that's lost, it's lost. It's not going to come back. You already lost the bone. So that's why we need to control from day one. We need to try to do the best we can every time we do it. Not play with the guarantee that I can give you this if this happens. Yeah. It's possible, but we need to try to avoid it. And if you can avoid it by spending a little bit more, using a much better implant, it's well worth it. Remember, you are already saving money by coming to Costa Rica compared to staying in the US. And that's what's important here. That's what's really important here, that you are able to save a certain amount compared to the same quality treatment than done in your own city, in your own state. If you're not able to save money, if you compare apples to apples and our price is exactly the same, you stay home. You're going to do much better home because you don't have to fly. But whoever is listening to us here and think that we can help them and we can make you save some money, we are your solution. Costa Rica, it's a very specialized country in the dental field, in all medical fields. But in the dental field, I can guarantee you we have the best of the best. Another question that we have, let's see. Thank you, Rosanette. She's saying hello. We did some work on her significant other. They're from Ontario, Canada. Hello, hope you are enjoying your smile. You're one of them. You're one of the many, many, many patients that we've seen, and we've solved their cases, and they are now running around, snapping their beautiful smile and eating whatever they wish. Let's see if we have another question here. Let's see. Insurance. A lot of people ask me about that. They tell me, Doc, you know what? Is my local insurance gonna help me pay for some of this? This is the thing. Costa Rica is not approved yet for American insurance to pay us directly, but we are able to fill out the paperwork. We have a team that does the filing and the filling of those paperwork so that you can take it with you and you can present it to your insurance company, and you will get reimbursed based on the type of account that you have set up with them. Okay, so it's not a question of us that we can charge the insurance company directly. It's a question of us filling up the paperwork, you presented it, and you can get some of the money back. Insurance companies don't like listening about dental implants or porcelain veneers or aesthetics because they consider implants aesthetics. How? I don't know. We need to explain them that that's not the way it is, but it seems like insurance companies don't have ears. Anyway, we all know a little about that. So you will get reimbursed for what we file in as extractions, root canals, crowns, cleanings, periodontal work, grafts, all those type of things. Let me see what else we got. Yeah, that's Roseanne. His smile is better than hers. No. Your smile is much nicer than his. Let's see. US. Okay, I have a question from Chuck from Miami. He's asking about the immediate extraction and implant placement. That's a typical procedure if there is no active infection going on at the extraction site. We like to do it that way because it helps the patient in two ways. One, it's only 2 trips to Costa Rica to get the full treatment done. Meaning, first trip, you come in, we do diagnose, we take out the teeth, taking care that the bone doesn't break or we don't harm the bone. We just take out the roots. We clean the socket, remove all the ligament, any signs of any little infection that might be going on. If we have sufficient bone support, we put in our implant at the same time. We do a little bit of grafting, and then we cover it with a reabsorbable or non-reabsorbable, depending on the case, type of membrane that serves like a sealant between the mouth and the surgical site, meaning no saliva can get in and no bone particles or bone can get out. You head home with that. After about a month, you're going to experience that everything is healing up very nicely and the socket's completely closed. We wait approximately 3 months more, and then you're able to return and we fabricate the final abutment and the final zirconia porcelain crown. Oh, let me see something else. Yeah, part of the question was as well about the crown itself. We don't do any porcelain fused to metal crowns because those were all type of crowns that we eliminated them because that tends to delaminate. You've seen those metal crowns that lose a little piece of porcelain that snap off, that breaks off. That was a problem that we used to find with those type of crowns. Those porcelain delamination. And that was the worst, and that was the worst call I could receive during the day of a patient calling me and say, Doc, my smile is beautiful, but this tooth right here delaminated, delaminated. And what is this? I have little chips of porcelain in my mouth. The only thing I could say, I'm sorry to hear that. The only thing I can do is get you back down here, polish it, or change the tooth over again. And that brought us a lot of headaches. When the new porcelain crowns, which are zirconia, which is a solid piece of zirconia that's milled by the robot to the size and shape of the tooth that you need, it's fabricated and then we can install it. There's nothing to delaminate, nothing breaks off, nothing chips. Color is beautiful, shape, we can do it whatever we want, and the result is very much predictable. Because it won't break. It won't break. The tooth will break first, the whole tooth, but not the zirconia crown itself. What else we got? Yes, I already answered that. It's clear that once we put the implant in, when we're doing individual implants, we need to wait a period of at least 4 months for osseointegration before we fabricate the final abutment and porcelain crown. Let's talk about bigger treatment options like the full mouth rehabilitation, like all-in-4, all-in-6, all-in-8. That's designed for people who have what we call a terminal dentition condition. That's a person who, let's say, from its whole upper arch, I can only restore in a predictable way less than 25% of its remaining teeth. Those people are a candidate for removal of all of its teeth and replacement with a complete set of dental implants. Complete set of dental implants, I'm not talking about one implant per tooth. I won't make that mistake over again in my life. I've done it and I will never do it again. I regret it because let's remember this. We're working with an organic human being that we are inserting metal screws into the bone to support a tooth or a full set of teeth. They are not natural pieces that are growing from your jaws. So the bone is very unique. The bone doesn't like to be pushed or shoved, doesn't like to have many metal implants very close together because it closes down irrigation, it closes down oxygenation, and they will move away. The bone cells will say bye-bye and they will start to dissolve. And that's when we get osseous problems and bone loss around our implants. That being said, I prefer to restore a full upper maxilla or lower mandible with with the least number of implants I possibly can in a well-distributed manner. This will help me achieve enough stability to support the bridge. And also, I'm giving the bone the chance to oxygenate, to so that the bone can flow properly and the nutrients can flow properly and maintain its strength by its own means. Meaning the stability of the bone is going to be assured. So when somebody tells you, Doc, I need 8 implants to replace everything up there, I say, why do you need 8 implants? Because they told me the more implants, the better. It's not like that. There are some jaws or maxillas that can fit 8 implants. Some others can fit 6, but most of them can fit 4. With 4 in a well-distributed fashion, which is the four legs of a table. We can support any type of bridge in a predictable, long-term way. Trust me, you don't need much more than that. Let's see. Cindy Reed, you guys are the best. Thank you, Rindy. Cindy, it's a real pleasure to have you here with us. Mariane Langran, she's lovely. Hello from Costa Rica to Switzerland. Okay, let's keep on talking about this. Oh, yeah, I like this topic a lot. I was going to show you some pictures, but I don't know. My technician here, my daughter, wasn't able to put them together for me. So it's going to be on another lecture. No choice for Chris. Chris is asking about my material of choice for the implant crown and the implant abutment. Okay, it depends on where that crown is located. In the anterior region, upper and lower, most of the time we use zirconia, white color abutments, and a zirconia crown. In the posterior area, most of the time we use titanium milled, a custom milled abutments for the implant, and we use the zirconia, full zirconia crown to replace the premolars and molars. But it all depends on the aesthetic